Today's drug is Citalopram, brand name Celexa. The pharmacologic and therapeutic class is that it's an antidepressant and a selective serotonin reuptake inhibitor, or an SSRI for short. The dosage form and strength. The medication comes as a solution in a 10 mg per 5 milliliter concentration, as well as a tablet in a 10 mg, 20 mg, and 40 mg strength. Indications and dosing for adults. The first indication is for major depressive disorder. The treatment range is between 20 and 40 milligrams by mouth every day. When initiating, start at 20 milligrams by mouth every day. May dose increase to 40 milligrams by mouth every day after 1 week. The max dosing is 40 milligrams per day. An off-label use is for obsessive compulsive disorder. The treatment range is between 40 and 60 milligrams by mouth every day. When initiating, start at 20 milligrams by mouth every day and increase by 20 milligrams every day every week up to a max of 60 milligrams per day. Indications and dosing for pediatrics. An important note to make is that the medication is not approved for use in pediatrics. The first off-label use is in major depressive disorder. For the age range between 7 and 11 years of age, the treatment range is 20 and 40 milligrams by mouth every day. Initiate at 10 milligrams by mouth every day and increase in 5 milligram per day increments every 2 weeks. The max dosing is 40 milligrams per day. For the age range of 12 years and up, the treatment range is 20 milligrams to 40 milligrams by mouth every day. Initiate 20 milligrams by mouth every day and increase in 10 milligram per day increments every 2 weeks. The max dose is 40 milligrams per day. The next off-label use in pediatrics is for generalized anxiety disorder. For the age range between 7 and 17 years of age, the treatment range is between 10 and 40 milligrams by mouth every day. Initiate between 5 and 10 milligrams by mouth every day with dose increases every 2 to 4 weeks. The max dose is 40 milligrams per day. The next off-label use is for obsessive compulsive disorder for the age range between 7 and 12 years of age. The treatment range is between 10 and 60 milligrams by mouth every day. The next off-label use is for obsessive compulsive disorder. The age range is between 7 and 12 years of age. The treatment range is between 10 and 60 milligrams by mouth every day. When initiating, start between 2.5 and 10 milligrams by mouth every day with a 5 milligram per day dose increase every 3 weeks. The max dose is 60 milligrams per day. For the age range between 13 years of age and older, the treatment range is started at 10 to 20 milligrams by mouth every day with a 10 milligram per day dose increase every 3 weeks. The max daily dosing is 60 milligrams. The last off-label use is an intermittent explosive disorder between the age of 7 and 17 years of age. The treatment range is between 10 and 40 milligrams by mouth every day. When initiating, start at 10 milligrams by mouth every day with a 10 milligram per day dose increase every week. The max daily dose is 40 milligrams. Mechanism of action and pharmacology. Citalopram works through selective inhibition of serotonin reuptake in the presynaptic neurons. It is a racemic mixture with inhibition primarily attributed to the S enantiomer. There is minimal norepinephrine or dopamine effects and little to no affinity for serotonin, dopamine, adrenergic, histamine, GABA, or muscarinic receptors. Citalopram is metabolized hepatically primarily via the CYP3A and CYP2C19 pathways. Metabolites are 8 times less potent than citalopram. The medication is excreted in the urine. The onset of action in anxiety disorders is typically seen within 2 weeks, with continued improvements through weeks 4 through 6. In depression, effects are seen within 1 to 2 weeks, with continued improvement through weeks 4 through 6. The time to peak is between 1 to 6 hours, with 4 hours being the average. The duration of action is between 1 to 2 days. The half-life elimination is between 24 to 48 hours and doubled in elderly and hepatically impaired patients. Citalopram is 80% protein bound. Special populations and considerations. In poor CYP2C19 metabolizers, the max dose per day is 20 milligrams instead of 40 in both adults and pediatrics. In elderly greater than 60 years of age, gradually taper when discontinuing. The AUC increases by 23%. Half-life elimination increases by 30%. In hepatically impaired, the max dose is now 20 milligrams per day instead of 40 milligrams per day. Renal clearance is 37% lower, and the half-life elimination is doubled. Concentrations in the plasma is also increased. In renally impaired patients, clearance has a 17% decrease in patients with mild to moderate impairment. In women, the AUC in some studies have been suggested to be 1.5 to 2 times greater than in men. Contraindications and cautions in patients: MAO inhibitor use within 14 days, electrolyte abnormalities, QT prolongation, chronic heart failure, bradycardia, a history of seizures, and abrupt withdrawal. For pregnancy, caution is advised, especially in the 3rd trimester, due to withdrawal symptoms and/or serotonin syndrome. For lactation, consider alternatives because there is conflicting human data. Side effects. Common side effects are xerostomia, nausea and vomiting, insomnia, tremor, fatigue, anxiety, agitation, dizziness, and abdominal pain. Some serious side effects are suicidality, exacerbated depression, QT prolongation, bleeding, priapism, seizures, and glaucoma. There is a black box warning for suicidality. There is an increased risk for suicide in children, adolescents, and young adults with psychiatric disorders and major depression. The risk does decrease in patients greater than 24 years and in 65 years and older. When using citalopram, weigh the risks versus benefits. Watch for unusual changes in behavior, clinical worsening, and suicidality. Citalopram is not approved in pediatrics. Drug interactions. Considerations for drug interactions. Considerations for drug interactions are in CYP2C19 substrates, CYP3A4 substrates, CYP2D6 inhibitors, antiplatelet effects, CNS depression, hyponatremia, lowered seizure threshold, drugs that prolong QT intervals, and serotonergic effects. Some contraindicated drugs to avoid are azithromycin, methylene blue injection, chloroquine, apixaban, aspirin, bumetanide, bupropion, torsemide, as well as many others. Monitoring parameters. Monitor for signs and symptoms of suicidality, changes in behavior, or clinical worsening, especially during initiation and dose changes. Monitor potassium, magnesium, and ECG if QT prolongation is a risk. Also monitor for weight changes in pediatrics. Patient counseling information. Citalopram is most commonly used to treat depression. It is taken with or without food, generally once daily in the morning or evening. It is important to keep taking the medication even if feeling well.